Hello, welcome to the Lowellian. My name is Lauren. Today I'm here with Hayley Williams from the Lowell Health Department. Welcome.
Hi, thank you so much for having me. I'm excited to be here today.
Oh, we're excited to have you. Can you tell us a bit about yourself and your work?
Sure. So I recently, not so much recent, about 9 months ago, I entered the health department. I'm the community health coordinator there. Before that, I worked in recreation. I was their head clerk and junior clerk and used to do Board of Parks, their secretary for that. And then before that, I used to work in the town of Bedford under the Council on Aging. I was a program assistant there, so I've kind of bounced around the health and human services. And it's nice because this position actually, as much as I love like the office side and, payroll and all that, like the business things, this I'm able to do like very in-depth community engagement and stuff. So then I'm also kind of like marketing the department in a sense. So it really works out for me to kind of mesh the two together.
I like that. It's a really good combo. What role does the Lowell Health Department play within the city?
So a lot of people confuse us with the community health center, and we are not. We are the city's health department. Just to put that little blip in there. I like to try to kind of differentiate the two the best that I can. But we kind of have a vast amount of divisions. We have public health nursing, school health nursing, tobacco control, substance use and prevention, homelessness initiatives. Then we have the community health side, which is myself. We have an epidemiologist, and then we also have a contact tracer, but we're almost past COVID, I would say, but she's kind of transformed into our like community health worker. She goes out with our co-op team. She helps our nurses. She's just like the glue of our department. And then we have 3 head clerks, director, we have a deputy of finance. So there's a vast of things that we do. It's more so than just, keeping the community thriving and healthy. We kind of also do trainings, educations amongst just the regular divisions day to day. It's a lot.
That's impressive. That's a lot of stuff.
Yeah.
So here at LTC, we cover a lot of meetings, including those for the Board of Health. Can you tell us what kinds of things might come up at those sorts of meetings?
Yeah. So the board provides policy direction in public health matters and concerns. They approve certain licenses and businesses and professions. And then they also act as a hearing forum for various appeals to actions taken by the health department, which in a sense would be like our tobacco division doing a compliance check and someone needing to come try to reappeal or appeal their, decision if it's a suspension or closure of the business, et cetera. And then same thing with any restaurant inspection that's done. If the restaurant has to close for a certain period of time due to whatever regulation, they can come and try to appeal the decision to the board, but it's all kind of within state guidelines and stuff too. And then amongst all that, our divisions also submit monthly reports to them, so they kind of review them and just act as like an advisory body almost.
So what are some of the projects that the health department has been focused on?
So right now, our biggest one is public health accreditation, which is, in a nutshell, just getting our health department certified to better serve the community. We can definitely provide more resources for anyone that's interested in learning about public health accreditation. There's a whole board that does the certifying, so you can always reach out to me or the department for more information on that. And then this past summer, it's not a current project, but this past summer we've held 2 TB screenings, which is tuberculosis, at the Lowell EA Emergency Assistance Shelter, and they're now in their follow-up care of that project. And then hopefully in 2025, we're hoping to expand our educational offerings and trainings around chronic and infectious disease, and then also hopefully doing CPR and stop the bleed trainings, and then maybe incorporating more Narcan trainings as well. And then we also just do general health educational things. So like hydration is a big one at our senior Council on Aging's, and then, sun and summer safety things like that. So kind of anything that we can kind of get out into the community and provide information on.
Do any of these things cost money?
No, everything we do is free typically. In terms of Stop the Bleed, I don't know and CPR, because sometimes there's kits for those. I don't know if that's something that, depending on funding, if we'll have or we'll be able to provide, but I would assume that it would be free, but we'll see.
That's really helpful stuff to know, for sure. What is the Northwest Public Health Coalition?
So that is still fairly new to me since I've taken on this position. The more I've learned about it, in essence, it's comprised boards of health and health departments of Acton, Dracut, Lowell, and Westford. The group was formed in the summer of 2021 as a result of the Public Health Excellence and Shared Services funding released by the Massachusetts Department of Health to formalize municipality partnerships, increase services, and to offer regional programs. And then they meet once a month to just talk about regional programs, shared services, develop other resources, things like that. And a big resource that they've created, well, their wellness coordinator of the regional coordinated was anything doing to do with substance use and mental health services. So it's all in a document for the greater Lowell and regional area, which is huge, huge to have at your fingertips right away.
Shifting gears. Regarding COVID-19, there are a lot of shifting and conflicting perspectives regarding best practices and prevalence of COVID. Could you comment on the current state of COVID and helpful points to be mindful of?
Yeah, I am by no means a medical professional. So I did consult with my public health nurse manager, and she had said that this spring the CDC and the Massachusetts Department of Public Health shifted from COVID-specific guidance to more general, holistic guidance that's in the same for all viral respiratory illnesses, namely COVID-19, flu, and RSV, which are in the peak of fall and winter season, which we are currently in. And then best practices, if you're home, if you're sick, stay home. You can come back and resume, normal work activities if you're fever-free after 24 hours without needing a fever reducer like medication. Wear a mask at that time if you think that that's beneficial for you or anyone you're around. Hand washing, the basic practices we were all reminded of, hand washing, covering your coughs and sneezes, the general flu season maintenance is kind of all the same for all of them now.
People can still get free tests online, right?
Yeah, so I believe it switches or resets every year. If you go to covidtests.gov, you're eligible, each household anyway is eligible for up to 4 tests. And if it's the same test they've been doing, it's 2 tests in a kit. So then essentially you could get 8 tests in total. Quick math. Yeah, and then they're widely available, at all pharmacies and stores, but sometimes the health department does have them. We don't currently, but if we're able to get them, it'll always be up on our website, or you can always call and check. We have a line dedicated to all of that anyway.
Are there any health-related matters that Lowellians should be aware of?
So nothing alarming on the horizon. In Lowell, we typically do and deal with, infectious disease case management, mainly on TB, tuberculosis, COVID, and then any foodborne illnesses that come up. But that's something that our epidemiologist would work out on a case-by-case basis if you were notified if that was happening to you. But then outside of Lowell, the wildfires across the state because of the drought is kind of concerning for the air quality. So that can kind of affect, very young or our elderly folks, people with certain health conditions, people who work outdoors, et cetera. So that's something that I think the risk should be taken serious of. And then it's nothing alarming for us, but the Massachusetts Department of Public Health sends out alerts, regarding first cases of clade 1 mpox in the U.S., which was identified in California, so total opposite end. And then increased spread of mycoplasma pneumonia, which is just your common case of pneumonia, and then even Bordetella pertussis, which is whooping cough, in Massachusetts, particularly among children. So again, it's not really Lowell-based, but it's still something that they ask health professionals to be vigilant of and mindful of. And it's just good information to put out there too as well.
Is there anything else you think would be good for the public to know?
Yeah, so I like to talk about our syringe collection program a lot when I'm out at events too. A lot of people don't realize that we have a sharps disposal kiosk in our office, and then the police department has one for pills. There's certain limitations and stuff, so I could go into detail about that, but you could also just call each office and see. But either way, if you have sharps that need to be disposed of, just make sure they're in a sharps container and or a bleach or detergent bottle. It just has to be puncture proof. We also do unwanted medication take-back days. We just did one this past October. We do 2 with the DEA, and then we're trying to do 2 more, hopefully, for 2025, just department-wise. So in total 4, that's our, sorry, I held up 5. In total 4, that's our hope and goal for our department. And then just again, if anyone or any community partnership organization is looking for an education or training, that's something that we can do within limitations. And then our epidemiologists and nurses can also just do regular generic, presentations on any chronic disease or wellness, things like that. It's kind of a broad category, but if there's any interest at all, feel free to reach out to us and we can try to coordinate something. Or not us, reach out to me. I'm the coordinator. I will coordinate that for you.
Is there a way for people to reach out to you or keep up with whatever the Department of Health is doing?
Yeah, so we have, the City of Lowell has their own website. It's broken down by each department. The city's kind of on a funky schedule. Mondays, Wednesdays, and Thursdays, we're open 8 a.m. to 5 p.m. Tuesdays, we're open 8 a.m. to 8 p.m. And then Fridays, open 8 a.m. to 12 p.m. So we have a late Tuesday, early Friday, which some people, I think some of the city departments are the same too, but it's a little tricky. But for the health department, that's the schedule we run on.
That's some really great information. Well, this has been the Lowellian. I'm Lauren. This is Hayley Williams from the health department, and thank you for joining us.
Thank you for having me. It's been so fun.